am excited to get this going, and thank you for being here. I am hoping to begin with a round of introductions, specifically for our panel members and CJC staff. So I'm hoping that you can state your name, your professional title or role, organization, and then just share a little bit about your experience with deflection. CJC will start so we can model this. My name is Casey Beck. I'm the Behavioral Health Program Manager at the Oregon Criminal Justice Commission. We also call that the CJC for short. I oversee all of our behavioral health initiatives and lead grant programming at that crucial nexus of behavioral health and criminal justice. Back in 2024, we heard from the Oregon legislature that we would be responsible for standing up a statewide deflection initiative, and I've been coordinating the behavioral health deflection grant program ever since. I'm joined in this effort to develop deflection standards by an amazing CJC team, whom I'll invite to introduce themselves now. I'll pass it off to Kim first, and then once our CJC team has had a chance to say hello, I will call on panel members by name, just so we don't miss anyone. So I will pass it to Kim first.
Thanks, Casey. Hello, I am Kim Phillips. I am a senior research analyst at the CJC, and I have been working with the Oregon Behavioral Health Deflection team since I started at CJC this past September. Happy to be here, and I will pass it over to my colleague, Will.
Good morning, everyone. My name is William Ash Houghton. I am also a senior research analyst at the Oregon Criminal Justice Commission, and I have been working on the Oregon Behavioral Health Deflection Program since late 2024, when it originated. And I'm glad to pass it to my colleague, Avery.
Hello, my name is Avery Sorensen. I'm a grant liaison here at the Criminal Justice Commission, and I have been working on the programs side of things also since the deflection's inception in 2024.
Thanks, CJCers. All right, so I'm going to call out our panel members by name. Again, if you had hopped in and missed the prompt here, we're hoping for your name, your professional title or role, organization, and then just a little bit about your particular deflection experience. In no particular order, as you are all amazing and welcome here, we'll start with Janie. Please introduce yourself.
Hi, good morning, everyone. Janie Gullickson. I'm the Executive Director of the Peer Company, formerly the Mental Health and Addiction Association of Oregon. And my connection to deflection is personally as part of the grant review committee and also as an organization that is connected to a few deflection programs and planning programs in Washington and Multnomah counties.
Thanks, Janie. Next, I will invite Steve Gunnels.
Good morning, everybody. I'm Steve Gunnels. I'm the district attorney in Deschutes County, and I was on the GRC as well. And we have a what I think is a pretty good deflection program here in Deschutes County that I've been involved in the formation of as the district attorney. We're not super involved in the day-to-day of it. The sheriff's office pretty much runs it with treatment providers, and they do a really good job.
Thanks so much, Steve, for being here. Next, I'll invite Jordan to introduce yourself.
Hi, my name is Jordan Gervin, and I am the deflection coordinator over in Josephine County, and I've been a part of this program since October of 24.
Thanks so much, Jordan. Let's see, next, how about Chris?
Hi, everyone. My name is Chris Campbell. I'm an associate professor of criminology and criminal justice at Portland State University and the director of the Criminal Justice Policy Research Institute within our unit. My experience with deflection stems back to Measure 110. We did a multi-year study on Measure 110 funded by the NIJ. And then I went to England to study what England has been doing in terms of out-of-court resolutions, which is effectively their version of deflection, where I met with Jack Charlier and the US Deflection crew. Coming back to Oregon, we just started Deflection, and I went straight to technical assistance, which is where I serve as a subject matter expert for Dan Hoover's technical assistance team. And I'm here today. Thanks.
Thanks for joining us, Chris. MJ, I'll pass it to you next.
Hello, my name is MJ Spoon. I'm a sergeant over the lead program at Marion County Sheriff's Office in Salem. I have been involved with LEAD for, I think, 3 years now, and I oversee both LEAD and our CARES team, which is an outreach extension of LEAD.
Thank you. Andrea, how about you go next?
Hi, good morning. My name is Andrea Rekla. I'm a licensed professional counselor and former deflection coordinator for Lifeways in Malheur County. I have been a part of Deflection since its inception when it was in early discussion, and helped develop our program here in Eastern Oregon. I'm happy to be here.
Thank you. Clint.
Good morning, Clint Riley. I'm currently the Lane County Deflection Program Coordinator. I've been the coordinator since the passage of House Bill 4002. I helped design and implement our deflection program here in Lane County. Prior to that, I worked for the Lane County Sheriff's Office for almost 29 years and retired as the jail commander about the same time House Bill 4002 got passed.
Thanks, Clint. And then last but not least, I'll invite both Patricia and Lisa to introduce yourselves. I know that you're tag teaming this particular expert panel role. So Patricia, why don't you kick us off?
Sure. Hi, I'm Patricia Sully. I'm the National Deputy Director at Purpose Dignity Action, which is the organization that houses the LEAD Support Bureau, and was one of the original architects of the LEAD program, which launched in Seattle in 2011. I oversee our national support and technical assistance work and our policy work. And I have been involved in this work since 2014. And I'll turn things to Lisa.
Thanks, Patricia. And yes, we are tag teaming. We thought we should both come today just to make sure that not everybody, but we'll try to not overstaff going forward. I'm co-executive director at PDA, work a lot with our national technical support team. And we, and Patricia particularly, have had the pleasure of doing a bunch of site visits in various counties, working on deflection and pre-booking diversion work in Oregon language deflection, and just have a lot of admiration and desire to support those of you who are doing such amazing work on that road.
Thank you. Well, everyone, I am expressing a lot of gratitude for folks being here today. We are excited and we're so grateful for your time and participation. Kim, if you don't mind sharing slides again, I think we'll get started and give everyone kind of a welcome to the panel overall. Since this is our very first time convening, I'm planning to start with a little bit of housekeeping, and then I'll briefly talk about House Bills 4002 and 3069 and the general why behind our quest to develop behavioral health deflection standards. And then last but not least, I aim to orient our BHD subject matter expert panel members to your roles and responsibilities on this panel. Next slide, please, Kim. All right, first and foremost, BHD expert panel meetings are public meetings. They are open to everybody. Public notice will be distributed ahead of scheduled meetings, and you haven't missed anything. Currently, there's only this meeting scheduled. We're planning to get the rest of them on the books for the remainder of this year. But details for all of our public meetings, including any relevant agendas or links to join, are available on the CJC's website, particularly on the calendar on the homepage. I wanted to note that there is time reserved at the end of this meeting for public comment, if desired. Until that time, we ask that members of the public refrain from speaking. And I wanted to note that meetings will be recorded. This one is being recorded right now, And that meeting recording link will later be posted to the CJC's YouTube channel and also on our website. And yeah, just a reminder that this is all public record. So wanted to make sure everyone was aware of that. You will notice that the chat function has been disabled. That's so that all the input and feedback can be captured orally for the meeting recording and that we don't miss anything in the chat. We kindly, ask that everyone stay on mute so that we can avoid feedback or noise interference. But panel members specifically, please come off mute and interrupt at any time. You can raise your hand if you want to, but that's absolutely not necessary. I just wanted to acknowledge that this virtual environment is awkward. And sometimes, at least for myself, it can be especially challenging and in kind of this discussion, you know, like this particular type of discussion of knowing when the right moment is to pop off mute and share your opinion or thoughts. That's the whole reason that you are here, and so we really want your input. Please do not be shy. Come off mute as a panel member at any time. You obviously see we have slides, and even despite that, we really want this to be a discussion with our panel members. So you may notice that we will minimize those slides at times in order to facilitate our ability to talk with one another. But we're really excited to hear from you, panel. Go ahead and navigate to the next slide, Kim. Thank you. So our establishing legislation. Back in 2024, House Bill 4002 established BHD specifically to provide grant funding to Oregon counties and federally recognized tribal governments for deflection programs. Those programs are collaborative programs between law enforcement agencies and behavioral health entities or community social services organizations that assist individuals whose behavioral health conditions, including substance use disorder, or another behavioral health condition or co-occurring disorders lead to interactions with the criminal legal system. Oregon BHD programs deflect individuals suspected of or charged with PCS away from the criminal legal system before charges are filed, and they do so in order to connect them to necessary assessment, treatment, and services for substance use, mental health, and co-occurring disorders. Next slide, please, Kim. The CJC is undertaking the work of developing standards for Oregon BHD programs, as is required of us by House Bill 3069, which says that the purpose of the program described in that section of the legislation is to address the need for more deflection programs to assist individuals whose behavioral health conditions, including substance use disorder and other service needs, lead to a heightened likelihood of interactions with law enforcement, incarceration, conviction, and other engagement with the criminal justice system. It's also our responsibility to track and report data concerning deflection program outcomes in order to determine the best practices for deflection programs within this state. And you'll note in bold at the bottom there that the commission shall develop standards and best practices for deflection programs in this state based on the information received from programs and pursuant to other sections in that bill. These are due to be published in February of 2027. And I wanted to note that the deflection standards are aimed at county BHD programs only and are entirely optional for tribal governments. So when we're talking about deflection standards, we're really talking about deflection standards for county programs. And I wanted to make sure that that was clear at the start. Next slide, please, Kim. All right, so, panel members, thank you again for being here. As you heard during introductions, everyone's coming from a variety of work and life experiences, and each of you bring a wealth of knowledge and expertise. It's really important to us at the CJC to invite input and feedback from different perspectives as we build and develop these standards, really so that we're not doing so in a silo. We invite you to share your expertise through comments, questions, opinions throughout this entire process. Hearing from you will help us ensure that the standards that we develop are legitimate. And in addition to legitimacy, CJC's goal is to develop standards that are relevant and useful for the array of state-funded deflection programs that's, are serving Oregon residents. We ask that you, as panel members, share your subject matter expertise based on your deflection experience from your perspective in your particular role. We have a very diverse panel here. Those of you who currently work in deflection in Oregon are not here as a rep of your county overall or your program's specific interests and goals. But instead as individuals with expertise in deflection and how it has rolled out in the last year and a half, based on your experience, your work, your background, your region. It's, I guess important to say that your perspective is shaped by your role, and we invite you to share that perspective. We kindly request that you do so through a lens that asks the following question: what will improve the success of the deflection program for Oregonians statewide? So thinking outside of your region, but really as like a state overall, for the betterment of Oregon. I do want to note, we take your input very seriously, and we want our standards work to be the best it can be. Ultimately, this panel is not a decision-making body. There will be no votes or polls for consensus. As directed by the legislature, it's the CJC who is responsible for developing deflection standards and reporting to the commission. But we would be lacking a very important piece of this picture without consulting subject matter experts like yourselves. We literally could not do this without you. So again, thank you so much for being here. I am now going to turn it over to my colleague, Will, for a brief overview of Oregon behavioral health deflection, as well as the CJC's standards process.
Thank you so much, Casey. Y'all, today I'm going to be providing a 30,000-foot overview of the BHD program. I'll talk about CJC's timeline for the development of BHD standards, and I'll provide a broad preview of the agendas for the subject matter expert panel meetings. Next slide, please. Thank you so much. So as you see here reflected in the map on the right side of the slide, there are 26 county deflection programs operated by 27 counties, which indicates one regional consortium. As of early May, there have been nearly 4,000 deflection events recorded in the statewide database, and more than 2,200 participants are currently enrolled, have completed, have been served, or assessed. Next slide, please. Thank you. And so the CJC, as mentioned, administers the BHD grant funds, supports the programs, and collects program data in collaboration with our amazing partners, including Dr. Liz Waddell's team at the Oregon Health and Science University, Portland State University School of Public Health, Dr. Dan Hoover's team at the OHSU School of Medicine, and Stephanie Renfro's team at the OHSU Center for Health Systems Effectiveness. So we are using data and information from multiple sources to inform standards development, including BHD program data submitted by program staff, state administrative criminal justice data, best practices from published literature, and this expert panel and the outstanding work done by each of you and your staff in programs around the state and region. Next slide, please. Thank you. So as Casey mentioned, the CJC's report on the recommended BHD program standards will be submitted to the legislature on February 1st of 2027. And then here at this June meeting, we will be discussing BHD program data outcomes, what standards are suggested by the data, and what the program data may miss. In August, we'll discuss criminal justice outcomes among deflection participants, what standards are suggested by the findings, as well as an early draft of proposed standards. At the October meeting, we anticipate discussion of the revised draft of proposed standards. And finally, in December, discuss the draft standards report, as well as review and refine the presentation of the defined standards. So I do want to pause here in case there are any questions from panel members. Hearing none and seeing no hands, now I'll turn it over to my colleague Kim to facilitate the discussion of the BHD program data findings.
Thanks, Will. I am really excited. I've been really looking forward to this conversation today. So let me give an overview of what we'll be talking about for the next hour or so. To develop standards for Oregon BHD, we started with the purpose of the grant program as defined in statute. Then we looked at how to estimate program effectiveness, which is the extent to which BHD county programs are achieving that statutory purpose. Then we tried to understand what sorts of things influence program effectiveness. And all of this info then helps us consider what standards are suggested. First of all, by the program data, and because the data alone can't tell us everything that we want to know, we also consider standards suggested by practical experience and additional sources of expertise. In large part, that's you all, and as Will mentioned, also available research and practice literature. So let's start with statute. I know we've had some already today, a little bit more. Oregon House Bill 3069 defines the program purpose. Deflection program means a collaborative program between law enforcement agencies and behavioral health entities or community-based social service organizations that assists individuals who may have substance use disorder, another behavioral health disorder, or co-occurring disorders, and who often have other service needs, to create community-based pathways to treatment, recovery support services, housing, case management, or other services. When it comes to assessing whether programs are successfully creating those community-based pathways, we can look to our program data to answer the question, how effective is the program at enrolling eligible participants in Deflection? To evaluate whether the community-based pathways effectively connect participants as intended, we ask, are program participants receiving treatment, supports, and services? And we go one step further to consider whether the treatment, supports, and services are making a difference by asking, are program participants experiencing improved outcomes? So the three evaluation questions based in statute now appear on the left of this slide, and to answer them, we need to identify outcomes in the BHD data that meaningfully represent participant progress. So for how effective the programs are at enrolling eligible participants, we look at how many eligible referrals entered the program, and we might think of this as the program's conversion rate. To answer the second question, we can look at how many participants who entered Deflection received any services. And this we can split into two groups, looking at both completed Deflection events and incomplete events. The next outcome is, of those who entered the program, how many completed it? And when I say completed, I do want to note that some BHD programs don't use this terminology, but participants may graduate or achieve alumni status. So today I will say completed, and I intend it to be inclusive of the different programs' defined criteria. So this is how many completed the program according to the criteria defined locally by the jurisdiction. And to answer the third question, we go a step beyond how many completed to look at the proportion who improved on any social determinants of health. In the BHD data set, the indicators we have include housing, employment, access to healthcare, and food sufficiency. And we have those outcomes among events in which the participants completed Deflection. I want to note there's another red text below, and because I want to note that at some point we will also be able to look at whether among incomplete Deflection events, participants improved in ways that program staff documented, such as, general quality of life improvement or substance use reduction. However, we just started collecting this information in February of this year, so we really don't have enough sample size yet to include this outcome in the development of standards. But starting in the next biennium, we will be able to include it in program evaluations. So looking at the right-hand side of this slide, and excluding that last aspirational outcome. Our key outcomes are entered the program of those who were eligible, received any services of those who were complete or incomplete, completed the program of those who entered it, and improved on any social determinants of health among those who completed the program. After defining our evaluation questions and our key outcomes, the next step is to consider what the data might tell us about program design or practices, or participant circumstances or characteristics that may affect how programs differ on these key outcomes. So on this slide are the participant circumstances and program practices that we just defined. And they are participant criminal charges at entry, which many programs use as an eligibility criteria, program duration, referral pathways used, handoff types used, who was the first point of contact for potential participants, who determined whether or not a participant was eligible, whether any screenings or assessments were performed, whether any services were received, participant diagnosis, that is substance use disorder, mental health disorder, or co-occurring disorders, and housing stability, housing safety, and housing situation at the time of program entry. Also participant demographics, we have age, race, ethnicity, gender, and disability status. So to analyze the program data, we put all of these potential influences together in a multi-level analytic model. And the results of that model then tell us how each of these factors relates to each of the key outcomes after accounting for all the other things in this list and the participants' demographics and the fact that participants are in different programs. Now, before we jump ahead to the results, I would like to pause here to see what questions, comments, or input the panel members have on anything I've covered so far, which is the purpose, our approach to evaluating program effectiveness, the key outcomes, or these potential influences on the key outcomes. And I want to suggest that we take about 5 minutes to discuss. Before we do, panel, again, I think you've heard this a lot, but we have a lot of expertise on this call today. But it doesn't mean that all of our expertise is interchangeable. So you may not be a data person, but I'm not a program person, but I just want to emphasize that in this context, like all opinions are welcome across all areas. So I will ask you first, do you have any reaction to the outcomes that we proposed? Does anything stand out to you as most important or anything missing that you would have liked to know more about? And I will go back to the outcomes slide. I'm also happy to minimize the slides if that would be more helpful. So panel, please feel free to unmute. Clint.
Yeah, one thing I would comment on this, I like where you're going with this. And I think one thing that wouldn't get lost with what you have here is somebody comes into deflection, but they don't complete the program or they fail out. Did they see a primary care physician? Did they go to the dentist? Did they do an ASAM? It's capturing little wins as you're going through, but also that is the journey to possible success. So I like the fact that you have that on. There's not a matter of did they do the program or not do the program? What did they achieve while they were in there? And then we capture them.
Awesome, thank you. The second, feel free to speak about that if I moved away too quickly, but the second prompt I have is, did you have any initial thoughts about the program or participant factors that may influence the key outcomes? Janie.
Yes, thank you. I feel like I'm in that half hour after eating a complete meal before going swimming. So needing to digest lest I get a cramp. So thank you for explaining though in such a digestible way. I am curious if there could be consideration, or if there is, about how many people who are eligible have prior criminal justice or incarceration involvement, and if that matters or it makes a difference to completion or even getting one service from those outcomes, compared to the group that this is their first interaction or prior to at Intercept Zero.
Yes, that is a really great question, and thank you for the opportunity to respond. So between now and our next meeting, or between noon today and our next meeting in August, that is my primary task, is to be analyzing the criminal justice data from the administrative data sets that we have. And I do envision creating some sort of characterization of participant complexity that is based on what charges, or how many encounters and that kind of thing that they had before deflection, as well as the criminal justice outcomes that we have in the system to date. How many, what does recidivism look like, to the extent that we have that landing runway as well. I hope that answers your question, but yes, definitely. And that will be the primary topic of our August meeting. Andrea.
Yeah, I too just wanted to echo, I love all the different data points that you guys are looking at and considering when you're looking at the key outcomes and how that influences participation in the programs. One of the things on here that, as a mental health specialist, is looking at the participant diagnosis and how those different diagnoses might impact that individual's ability to engage in these different programs. And my second thought on that was just really the consideration of not only the first point of contact, but how that contact is happening. So not the who, but the how. And so I'd be curious to see more about different types of engagement or levels of engagement when engaging these folks, and whether or not that influences their participation in the program.
That's a great point, and I have a follow-up question that I will save for later. Not that any of you should be saving things for later, but I'm going to save something. Come back to you, Andrea. Thank you for those comments. Chris.
Yeah, thanks for this. I think the big thing that is sitting in my mind a little bit, and you might be getting to this here, and Andrea kind of hinted at it, is just how are these operationalized ultimately? I know that how the data is collected in terms of REDCap, it might be at certain different points of a person's experience going through the system, depending on who's putting the data in, when they're putting it in, and how they're identifying the definitions of each one of these. So I guess my question is more of just how are each of these operationalized, and is there a way that we can just get a definitional list of that operationalization at some point, so that we can better understand the results, and like I said, maybe you're getting into this.
Thanks, Chris. I am not getting to that, and I am happy to provide it. I think I'm hopeful that some of what's in your packet that the panel members received, there is a definition of each of these items, but I'm happy to provide more robust information or connect with you like later to talk data staff. So whatever works. And of course, all panel members will be informed of anything that comes from those conversations offline. Thanks for the question. And your point is really well taken, that how programs enter these data is not necessarily uniform. Clint.
Yeah, thank you. I know one thing that's challenging for everybody, but it's one thing that's just a fact. If you limit people that are on supervised probation, supervision of any sort, or warrants, you're taking away about 90% of the folks that need the service. However, those restrictions, they're not easy. That's difficult to work with all your local courts and your police departments with how you clear a warrant and offer someone deflection. And there's a whole nother workload that happens inside. But that's a piece of like those are the folks that need the help the most. But you're very seldom going to come across someone that's first time in the system, doesn't have anything pending, and you're bringing them in the program. So that challenge is always going to be there. The charge is one thing, but it's all these other court challenges. But one benefit you can have, once you get them in the program, you can help clear up all those outstanding things that are going on. And when someone's in addiction, the last thing they're doing is going to court. So you're seeing these things mount and mount and mount. And so, but it's challenging to work with all your partners to get that stuff cleared up.
Thank you very much for that comment. And I will say that, you know, even though that's not something that my program data can address directly, I think that I may be able to do a little bit more with the criminal justice data, maybe looking at like which programs have different criteria regarding supervision. However, I have some caveats to that, which I'll hold on to, but I just think that's like exactly the kind of comment we also want to hear, that this isn't reflected in the program data that I have and that I'm sharing right now, but that it is important in your experience. So I really am grateful to you for that comment. And
one thing we might be able to capture in like RedCap is asking that question when somebody comes in and we capture, are you on probation? Are you on parole? Do you have warrants? And then as you start to see, majority of the folks that are coming through absolutely have all that going on. And another good one would be, do you have a valid driver's license? First thing that happens is your license gets suspended with fines and fees, and then you kind of start to go down that system there too. But most folks have lots of things going against them when they come into these programs, and you got to work to get it back.
I appreciate that. And yeah, noted. I am going to move us on now. I know there are other hands, and I will just say there will be plenty of opportunities for further discussion. So thank you. All right, let's move on to what the data showed. So our analysis showed, first and foremost, that between programs effects were really huge. What does that mean? It means that as a deflection participant, no matter who you are or what you bring through the door with you, which program you show up in is the biggest determiner of your outcomes, most of your outcomes. So in some ways, this isn't surprising. We know we have a lot of diverse program approaches, but the size of the effect was such that it was important for me to state that very clearly. So that told us that we needed to take another step in our analysis, and using all of the program and participant influences we just discussed and considering them all together, we computed the probability that each program would achieve each key outcome. From there, we created program profiles, and the profiles are based on which programs had the highest likelihood of a particular outcome and which had the lowest. And on the next slides, we'll look at the characteristics shared by programs in the high probability group side by side with characteristics shared by the low probability group. And of course, all these are based on the data we have. This is definitely not about declaring winners. In fact, we could not do that if we wanted to, because programs varied in their likelihood of the different outcomes. Their strengths show up in different places. So we can see patterns, but there were no one or two sites who were universally best across all key outcomes. And that's another part of what makes this discussion today even more necessary and exciting. We don't have a ready-made blueprint to copy. Instead, we'll be borrowing the strongest elements from different places to maximize overall statewide program effectiveness. So the first outcome, we'll look at each key outcome, what the data showed. This one is deflection entry, and you have the programs with the highest likelihood of enrollment among those who were eligible, and the programs with the lowest likelihood of enrollment among those who were eligible. What I'm sharing are only where the groups appear to differ. This is not a statistical test of difference between the groups. It's just a description of characteristics shared by programs in those two groups. And for my data friends, looking at those in the highest quartile and those in the lowest quartile. So I'm going to state what's on the slide, and then I'll pause to get reactions and thoughts from the panel. We'll spend just a few minutes on these specific findings, and we do have time. I have saved time for a more robust discussion at the end, but I will try to take my cue from you, panel, as well. So, programs with the highest likelihood of enrollment among eligibles, about 76% of the entering participants had PCS only charges or no criminal charges. Among the lower group, about 96 had PCS only charges or no criminal charges. And then in the high group, most referrals used the officer intervention pathway. The second most frequently used was first responder and officer referral. In the low group, most referrals used the active outreach pathway, and the second most was officer intervention. So panel, feel free to respond if something strikes you, if this is really contradictory to what you know in practice, or do any of these findings, this is what I'll ask across each of these finding slides, do any of these findings seem actionable for improving deflection effectiveness across states? So any comments on findings regarding deflection entry? Andrea.
I think it's more of a question for me in really reflecting on the state of relationship between the law enforcement behavioral health entities as to deflection entry and how that occurred. So that would be my question.
So you're saying, let me restate. So you're saying that it's not the data points on the slide that really interest you, but more the interaction among the players about how this entry comes to pass.
Essentially, yeah, when you're looking at highest likelihood and lowest likelihood, how is that impacted by the relationship? So when we're talking about in the highest likelihood, most of them were officer intervention pathways. And in the lowest likelihood, the referrals were coming from active outreach. And then secondly, officer intervention. Between those two, is there a difference between the way that those organizations operate together and why that's the higher pathway versus not? Does that make sense?
Yeah, it does make sense. And I'll tell you, my thought when I saw this, just for what it's worth, in case it's helpful for other panel members, I thought, well, this is logical that a lower likelihood of program entry among active outreach, because they were sought out. They were not, facing imminent criminal charges necessarily. To me, that's maybe an explanation of active outreach. Obviously, I defer to all of you and your vaster and more practical experience. But yes, thank you for that. Chris.
Yeah, thanks for this. I realize that Andrea and I are very, very a similar thought pattern here. I think one of the things that kind of stuck out, well, two things actually. One question was, were you all able to, in these multi-level models, were you able to account for county level differences, maybe in population density or the number of services available in a given county? I know that OHSU had at one point did a gap analysis of treatment services that were not available, but I was just curious if any of that type of stuff was able to be included.
Yep, great question. No, this is using program as the cluster variable, no external data sources or information.
Okay, thank you. And then the second question had to do with probing interactions. So this kind of hints at what Andrea was talking about as well. So I immediately think of what are warm handoffs a possibility in that program versus not. And I imagine that that probably panned out in your profiles to some degree, but I was just curious if that was explored, or you could even explore that.
Yes, and I would say that in the profiles, handoffs don't appear as a finding here because there was no distinguishing characteristics among programs in the groups. So like I couldn't say that the highest likelihood programs used warm handoffs and the lowest likelihood used reflection or referral to deflection. They were either inconsistent within groups or consistent across groups, if that makes sense. So handoff's not here because it didn't appear meaningful on this outcome.
Gotcha. Thanks.
Yeah, of course. Janie.
Yeah, thank you. I'm not sure if this is similar to what Andrea was asking about, or if I'm just missing something. What I'm feel like I'm missing is for the lowest likelihood, the most referrals use the active outreach pathway, but 96% of entering participants had a PCS. So how did they get that PCS if there was active outreach? Was that still by an officer? Because I'm
Okay, that's a
confused.
great question. And you know, I can see how these two findings right on top of each other are not giving the full story. So I lumped together 96% where PCS only or no criminal charges. It's likely that the active outreach had no criminal charges. And I didn't tell you what percentage had no criminal charges. So I think that's what you're wanting to know, and I did not tell you. So I apologize for that. But thank you for pointing that out. Yeah, but that would be the explanation, is the active outreach. So probably falling into that no criminal charges bucket. Jordan.
Yeah, I'm just kind of bouncing off of what Chris had just mentioned, just kind of questioning the warm handoffs taking place. And just speaking from like experience, like that made sense, at least on a county level factor, because our program uses warm handoffs at a 24/7 facility for every single officer intervention pathway. And so that, that data really made sense to me and resonated. And I'm just was also curious, like what the warm handoffs look like for other counties.
Thank you so much, Jordan. And it's really, so handoff on this outcome did not seem to be a significant factor. Some programs very successfully use warm, some programs very successfully use instructions to report to deflection. And yeah, it seemed like it was more dependent on the program than the handoff across programs.
Okay.
Yeah, Casey.
Yeah, Lisa, I do see that your hand is raised, but since Patricia's the person who's tagged in for this particular meeting, we're going to ask you to hold your comments.
Thank you. Okay, thanks, Casey. Lisa, I felt terrible not calling on you, and I just was unsure what to do, knowing that Patricia's the representative today. So thank you for your patience and understanding.
I wasn't.
Can we just swap us out and have Lisa be the representative?
Casey?
Yeah, I wasn't aware of that. Sorry.
Yeah, I feel okay with that. Sorry, that is what was communicated to us. So yes, we can officially swap that out, and we'll have Lisa be the representative today.
So sorry.
Thanks, guys.
So sorry about that. Wasn't trying to break our
Not at
arrangement.
all. Not at all.
So quickly on these points, these are very consistent patterns with what we have seen in the Seattle LEAD program that has multiple points of entry, officer direct referral after arrest, officer nomination before arrest, and community referral. So sort of all the options occur within our framework, and so we can look comparatively. And consistently over many years now, there's a considerably higher intake rate for people who are experiencing a warm handoff in field from officers. And have lots of thoughts about why that might be, but
Thank you.
the reason that I put my hand up earlier, and I just would add this comment that I think the unanswered question, sort of in the legislative definition of deflection, is, to what end? What is the primary aim? If the primary aim, which we would urge that it be, includes to prevent unnecessary entry into the legal system because a better response is being offered through this framework, then a focus on the population that is otherwise headed into that system has to be engineered. And a data point that we always collect is what was the person's known sort of exposure to enforcement? What crimes is this person known to be committing such that they are at a high risk otherwise of heading into the legal system? And that is information that we can answer for every even community referral that was nominated by Outreach or another community partner. So I would suggest that might be valuable to know in order to be able to sort of validate community non-law enforcement referrals to still be in that, if that is of value.
Yes, definitely. Thank you, Lisa. And I do think that echoes what Janie was saying as well, and is something that we'll be looking at next with the administrative data. I will say, just to note, just for what it's worth, I mentioned that the between programs effects was really important for this, but within programs that use multiple handoff types, instructions to report to deflection was 2 times more likely than warm handoffs to result in deflection entry among Oregon programs. So for what it's worth, I'm going to move on. The next outcome is services received among those who completed their deflection events. This is the only outcome that didn't vary by program. So no matter where a participant gets deflected, those who complete the program have about the same likelihood of service receipt. And the first finding was that participants with no diagnosis are less likely to receive services. I think that makes intuitive sense, but happy to hear from you. And finding 2 was, regardless of program, a participant who receives any screening or assessment is much more likely to receive services. That is among completed participants, and that is regardless of whether a program requires assessment or requires services to complete or graduate. We did conduct some fidelity assessments to learn about whether programs were implementing criteria that they had stated in their application for funding, and we found overall quite low fidelity. In fact, on this one, we found that programs without the stated criteria to perform assessments were actually doing them more than programs with the stated criteria. So for what that's worth, I will pause for your reflections. Do any of these findings seem actionable for improving deflection effectiveness across programs, or is there anything that otherwise really jumps out at you here? Andrea.
Yeah, so just thinking on, the screenings and assessments and how that leads to engagement treatment services. I think sometimes considering where those screenings and assessments are occurring is really important. So in terms of actionable items, having the ability to bring those screenings and or assessments to the participant as early as possible. At least in my experience, I've seen delays or dropout due to they meet with the deflection navigator, have a really good interaction with them during that intake, but then they're scheduled for their appointment at a later date. They may not show up, or showing up to a community-based service might prevent or present barriers for them. And so just wanted to call that out.
Thank you. Janie.
Hopefully just another quick clarifying question. Thank you. Where are diagnoses coming from? Are they self-report or are those determined after an assessment as part of deflection, formally or informally?
Yeah, that's a really good question. Either, and I have not distinguished here. I will invite you to correct me if I'm wrong on any of this, but in our data, the person who's entering the data, the program person, indicates whether there is a diagnosis, and newly there is an opportunity for them to say where this information came from. Did they perform a screening or assessment? Did the participant report it, or was it suspected, or I guess not suspected, assumed based on like previous treatment, something like that, or residential treatment or something like that. Will, do you have anything to add?
No, I do have the list of the available options that are here, and you've captured most of them. So it's use of an evidence-based screening or risk tool, self-reported, previously documented, observed by staff, presumed due to reserving treatment. So
thank you. Thank you. Good question, Janie. All right, moving on. The next outcome is a service receipt among incomplete deflection events. And I have 2 slides on this one, so we'll just pause briefly on both. Again, we have the PCS only charges. 22% of those in the high likelihood group had no charges versus 99% of entering participants in the lower likelihood group had PCS only charges. So a little bit more variety in the highest likelihood group. For referral pathways, 80% in the high likelihood group used officer intervention versus 99% in the low likelihood group. And then here, handoffs was a characteristic shared by programs with a higher likelihood of service receipt among incomplete deflection events. 85% of handoffs were either instructions to report to court, deflection, or provider, or referrals to the deflection team to do outreach. So not that warm handoff that we know and love so well. In the low likelihood group, there was nothing consistent for me to report. That each program did kind of its own thing. Anything you'd like to pause on here, panel? Chris.
Yeah, I was just I was looking through the report, and I apologize that I did overlook some of the operationalized definitions that were.
Oh, that's okay.
And I know that this differs by program because not everybody necessarily has a timestamp. But I'm curious, were you able to like probe how long it took for someone to be actually in a position to engage with services? Because I imagine that has a huge factor, or that has a huge influence as to when somebody falls into the highest likelihood versus the lowest likelihood. Yeah, there's the warm handoff, but how long does it take between point of contact to referral, essentially, to a place where you could potentially actually engage in those services or have an assessment of some kind? I didn't know if there was any metric like that to be examined.
I did look at program duration, how long they were engaged between eligibility and exit, or, in this case, not completion, but whenever they were determined to be incomplete. And there was nothing significant there. I did not look at, I don't have information about when the assessment was performed anymore, or not assessment, but I don't have any more detailed information than that. I don't know when services were received, for example. So I don't really think I have anything to answer your question.
That's okay, and I appreciate that. I think one of the things that highlights in terms of actionable thoughts going forward is trying to devise a way to kind of timestamp when things occur, because so much of this, the relationship to getting somebody engaged and meeting them where they're at is kind of in the moment. And if you have days versus hours in where somebody is in relation to the treatment and the services that are available, that can be all the difference sometimes. Yeah. And so thinking ahead and moving forward, if there are ways to timestamp these, and not necessarily to the minute, but at least in the day or within a day or so, that would be probably a really good thing for all programs to try to move towards.
Yeah, that would be some nice data to have for sure. I will say that I don't even know how much time goes by or what sort of triggers a program staff to mark someone as incomplete. You know, that could vary very widely. So duration when it comes to the incompletes is especially maybe less helpful, but Clint, please.
Yeah, to piggyback on what Chris just said right there, if we did have a way to track if somebody gets deflected and they don't report within 3 days, we could have a percentage of they're this percent less likely to complete the program, where you would have one if somebody gets it within immediately to 8 hours to 24 hours. We would be able to develop best practices to say, if you have a program that's not connecting people for say 7 days, your likelihood of connecting them at all is this percent. And the longer it goes, just like Chris said, the less likely someone's going to engage, even if they want to. At that point, the addiction's driving all their decisions. And so it's paramount to be quick. But I love that idea of trying to track that would give us good data to help us build our programs.
Yeah, that's great. Thank you for that. I can tell you that on this outcome particularly, I looked at overall program duration. I looked at some categories of program duration, and nothing was statistically significant within programs. And so yeah, I mean, I had less than 30 days, 30 days, 31 to 90 days, 91 to 180 days, and more than 180 days, and nothing stood out as being more meaningful than another on whether services are received among those who don't complete the program. And for that matter, among those who complete the program. Casey.
Thanks, Kim. I was just trying to, I guess, clarify my understanding from Chris and Clint to make sure I'm getting the question correct, or I guess not the question, but the idea. Are you two specifically thinking about handoffs? So the space and time between someone being, the first ever contact in a field to the time that they're entering the program or like actually engaging with someone like relevant to the program, and therefore that like 8 to 24 hours, and 24 hours to 3 days and longer than 3 days, those kind of like categories there are related to like when you're first encountering that individual and when that person is being connected to a navigator or being connected to a case manager. Is that what we're thinking?
Well, that was the majority of where my mind was. But there's also a great deal of utility in the follow-ups. So how many contacts, when are the contacts, how much of a reach out is there afterwards when somebody actually engages that first time? So, when you're talking about how much of dosage, so to speak, of a given program or treatment, is it about case planning or their how much of their case plan that they've completed, or is it more about how many contacts that they've had? How many times are people outreaching to those individuals in between the first contact and the next contact? All of those things can be collected. I've seen some, nonprofits, Pathfinders Network, for instance, uses Apricot, and they use various versions of a given system to try to timestamp those times in which their peers are able to reach out to folks.
Mhm.
And that's in a different context, not deflection necessarily. But the idea is that's a feasible data point, and it could be really meaningful when it comes to connecting somebody with treatment and then maintaining that connection throughout and figuring out when people kind of tend to drop off and what the context of those drop offs are.
Okay. Thank you so much for clarifying. That helps my understanding.
Thanks, Casey.
What I meant by mine too is we have a housing component to our program, and but what I'm seeing in real time is the folks that take deflection when our navigators are right there with law enforcement and take the housing to develop the plan. I'm seeing more success than somebody that is unhoused but doesn't want the housing, and we schedule them to come follow back up within a couple of days. Oftentimes they don't follow back up. If they take it immediately and they're right there, I'm seeing better outcomes right there in real time. And so if you can get the person connected right when they're saying they want the help, and you can provide the supports to build the plan and get them to the help, you're going to see better outcomes. But I'm also seeing folks that take the stabilization, and 3 days later, they're not ready for that journey yet, and they leave the program. So you're seeing, depends on where the person's at, but the more resources we can pack around that person immediately, the better success we're seeing.
Thank you. I'm going to move on. We need to move on. So the next slide, I will say though, if you have a comment that you don't get to make, please send it to us. There may be time later in this, we still have an hour left, but I definitely want to hear from you. So please send anything you have our way later in this meeting or off to the side. All right, slide 2 for this same outcome services received among incompletes. Among the highest likelihood programs, 60% of the time first contact was with law enforcement, 32% of the time it was with peer support workers. Among the lowest likelihood programs, 96% of the time first contact was with law enforcement, so much higher proportion. Program duration, we were just talking about this. In the model, duration is not meaningful. Among the program profiles, so the higher likelihood programs, 84% had an average program duration of 31 to 180 days. There's a range for you, but there it is. And in the lower likelihood programs, 89% had an average program duration of less than or equal to 30 days. So that is a difference. And then finally, eligibility determinations were not so often made by law enforcement in the high likelihood group. It was an average of 15% of the time, and the range was up to about 55% of the time, about half the time. Eligibility determinations were more often made by the deflection coordinator or team, so 53% of the time up to 98% of the time. Again, not statistical. We're not looking for a statistical difference, just a descriptive kind of characterization of what these programs share. Eligibility determinations among the lower likelihood group, it was not consistent. There was no pattern that I could comment on. So anything from the panel? Chris.
Sorry, yeah. So this was the comment that I was going to make. Was
okay, awesome.
I think that some of these things that we're observing here, which I fully appreciate all the analyses that you've done. I know how daunting some of these data sets can be because there's so many different relationships that you can probe and break out that are all relatively meaningful. But I do want to highlight for everybody's sake and for my own to keep in context is that some of these, such as 96% of the time, first contact was law enforcement for the lowest likelihood, but it's also of characteristic of the highest likelihood. So these, what this kind of signals to me at least is that it's a function of the structure of the program and the eligibility of these programs collectively, rather than something that is particularly something that we have to keep, so to speak. So the PCS only is another one, right? And you kind of spoke to this previously when I think Andrea asked a question. But I think that there's some negative space in there that is that in between the lines. What about the others? What do we see with those? Those types of things we can probe, later in discussion and analyses. But this is very much an example of how the eligibility criteria, when it is stringent and it is consistently common across a lot of the major programs, especially the largest programs, then that's going to stand out particularly on both the lowest and the highest likelihood. So just an observation, really.
Yes, yes. I would like to engage in lengthy discussion with you about that comment, because there are many relationships that we can probe within the data, but I feel pretty strongly that we need to pay attention to the model findings, because those are the ones that control for everything else. And I don't want to get too distracted by relationships that aren't controlled, and so, and also, you're right. I mean, does who was the first point of contact really directly relate to whether someone who didn't complete the program received any services? No, not in the sense that that law enforcement contact is not the one who's providing services. So yes, it hints at program structure, and how do we get at that? I think we look to you to help us figure out what that actually means in practice. Because it wouldn't make sense to have a standard that is, make sure that first contact is with peer support, otherwise they might not get services. That's not it. So what is driving these differences that we see? Your opinions really help so much. All right, I'm moving on. The next outcome is who completed deflection out of those who entered. And in the high likelihood group, 94% of participants had PCS only or no charges. In the lower likelihood group, 82% of participants had PCS only or no charges. What that says to me is that, that means that there was a higher proportion of those who had either charges that weren't PCS or PCS plus other co-charges. So potentially more complex or reoffenders or all of the things that hopefully we'll get at the next time around. I don't know if that's what it says to all of you. In terms of first point of contact, it was less often law enforcement among the high likelihood group, more often deflection teams or peer support, whereas in the low likelihood group, it was law enforcement 98% of the time. And then eligibility determinations, 61% of the time eligibility determinations were made by the deflection coordinator when a participant completed deflection versus 94% of the time eligibility determinations were made by the deflection coordinator. So the deflection coordinator is showing up a lot across both groups, more often in the low likelihood group. Clint.
Yeah, question on that last one. Is that based on the eligibility criteria for that particular program, or is there a determination being made once they're being looked at to commend the program by the coordinator?
That's a great question. I think I'm going to conflate and say both. Like, that's the determination being made by the deflection coordinator based on that program's stated criteria, is my understanding.
I support that understanding, for the record.
Yay.
Thank you.
Completed deflection, I wish we had a whole meeting just on this outcome, to be honest, because completed deflection is based on programs' stated criteria. Therefore, how meaningful is it as a key outcome? I don't know, but I count on you all to help me know how much weight to give that one. And I think, Andrea, you talked about that before, as did a couple other people. We have one more key outcome set of results, and then we'll kind of go back to the big picture. And we have a 2-slider again. So for any improvements on social determinants of health, the high likelihood programs, 71% of referrals used officer intervention. Among low likelihood, 89% used officer intervention. So some of those other pathways were associated with social determinants of health improvements. Average program duration among the high likelihood programs, again, was that long range of 31 to 180 days. No consistency across the low likelihood groups. For first contact, it was inconsistent among the high likelihood group. 96% of the time it was law enforcement among the low likelihood group. I think I'm actually going to finish this outcome, and then we can talk. 59% of participants received a screening or assessment in the high likelihood group, but the range was pretty high. It was 49 to 81%. So half to more than half were doing screenings and assessments. No consistent practices across the low likelihood groups. 59% of participants in the high likelihood group received any services. Again, the range was 46 to 81%, whereas an average of 35% of participants received services in the low likelihood group, and the range was lower, 19 to 69%, but the range overlaps. So I can't say if that's meaningful or not. I'm really interested to hear from you and your experience and knowledge. And then housing, nothing consistent across groups in the high likelihood versus in the low likelihood programs. 69% were unsheltered at program entry. The range was 43 to 72%. Now, across all participants in Deflection, a very high proportion, I think it's like 60-something%, are unsheltered at program entry. So just want to make sure you have that context. So on this outcome, any improvements in social determinants of health among those who completed the program? Panel, what would you like to point out? Or do you see anything that looks actionable for standards, improving Deflection programs across the state? I can switch slides if you'd like. Andrea.
I would just say for our county, being in Eastern Oregon, very, very frontier area, housing was probably one of the #1 biggest determinants of entry and engagement and completion of our program. Having safe housing is crucial. And when there's a lack of access, it makes engagement, all those other things, a lot more difficult.
Absolutely. Thank you. Okay. I think that we are probably all a little weary of looking at specific program data results. So let's do this. Let's go back to those evaluation questions and refresh our memories from earlier. And then on the next slide, I have some discussion questions. And we have, I would say, about 10-ish minutes to talk. So recasting slightly to shine a light on what the data showed, we asked, what practices strengthen programs' ability to create community-based pathways for deflection? What practices help participants access treatment supports and services? And what program practices are most likely to improve participant outcomes? Those were the questions that we wanted to answer. In answering them, let's reflect on all that we've covered, like what the data showed and what it may have missed. I think that's come up several times, and I appreciate it very much. The prompts we hope to discuss are on this slide. Like I said, we have about 10 minutes. What stands out the most to you? I should preview for you, actually. We have about 10 minutes to discuss, these questions. And then Will's going to take over and we're going to zoom out again and, entertain anything that the panel wants to discuss. We felt like it was really important to make space for both. So What stands out most to you from the data findings in your practical deflection knowledge and experience? What things contribute most to program effectiveness and success? And perhaps most importantly, what standards are suggested by the data findings and by your knowledge and experience? And we're talking here, you don't have to give me a perfectly worded standard that I will type down, but categories like types of standards. I think something related to time from entry to handoffs, things like that are totally fine. And I'm happy to minimize the slides or keep them up. I will take my cue from you, panel. This is your time to shine. Clint, thank you for getting us started.
I just wanted to, as we go into this one, this is a good segue from what we were talking about a little bit ago. Like, I think we need a better definition of what we think success is. And success, in my opinion, if you can get someone to engage in their own well-being and start to consider treatment and start to look at getting healthier, you will look at the other side of the equation and their criminal behavior will decrease almost 100% of the time. And so I think as we define what success is, these little tiny bites at the apple get the end result of what we're trying to get to. So I think a better definition of what is success. Success is getting someone to try to go down a different path. And then if they do that, we get the desired result of their criminal behavior decreases or goes away in most places. They get their life back, they're healthier. And so I think as we look at these data points, how do we have one basic definition of success that everyone can all agree upon and understand? And then we start looking at the data points to help us get there.
I am going to pause on that, and Andrea seconds that. So so I'm going back to the key outcomes, and what you really want is a different way to define success. And I want to hear more from the panel about what that is, because it sounds like what I'm hearing you say is success is not encapsulated by entering the program or by receiving services or by meeting the program's defined criteria for completion or by social determinants of health improvement. What is missing that is the outcome we are looking for? And Clint, please answer if you'd like, but anyone and everyone, I would love to hear your thoughts. Chris.
I think Janie had her hand up first.
Yes, I didn't know if Janie wanted to. Janie, please unmute if you want to answer that question. Otherwise, I'm going to turn to you next. But if somebody wants to answer that question first, I would love it.
Yeah, I was glad for Clint's question, and I believe thinking along the same lines as I read through and then through today's sharing of information. Are we using those social determinants of health as the measure of success? And if we could actually define it more, if I remember right, we can't use recovery as a measure of success, because that's not always entirely the goal, even if that's our hope. But could SAMHSA's definition of recovery, that wellness, self-directed life, I wish I had it memorized, I don't, but in many ways that encompasses those social determinants of health. And so I'm just curious if we could use a definition like that, where improved quality of life, or even something more validated like recovery capital scale doesn't measure abstinence or definition of recovery, but progress towards something.
Thank you, Janie. And I will turn to Chris and Steve in a moment. I think this is so fundamental that I just appreciate you holding on for a moment. I think what I'm hearing you say is collect different data, right? I mean, I've given you the outcomes that I have, and you're saying this doesn't get at it, this isn't success. And now you're giving me ideas for success. And we at CJC need to sit with that and discuss that a bit, because we are not going to have an opportunity to collect different data before standards are due. And so we really, as Casey said, we really want this work to be meaningful and the best it can be. And yeah, thank you. Keep talking and we will listen. Chris, you're next, and then Steve.
Well, it's kind of in that same direction. So I'm still digesting a lot of the key outcomes that you've presented and sent along. So in lieu of that, I just wanted to highlight one of the things that Jenny was just saying, which is I think there are other meaningful things that could be out there. And I know that you don't have the ability to collect more data between now and when the standards are due. That said, I think there might be some places there that do collect some of this information that didn't go into REDCap necessarily, that might be meaningful. It just depends on how they were collected, and how much there is out there. That might be up to the sites to offer up some of that extra data that you might be able to connect to this information. I would say that one of the things that I think a lot of folks and maybe prosecutors in particular are concerned about is whether or not the person comes back to the system. Mm-hmm. And I know that arrest is one thing, but the one thing that's missing between the arrest and the social determinants of health are all the criminogenic factors that we know are important, right? All the things that like the LSCMI, level of service case management inventory, might touch on, but doesn't necessarily unpack. All those factors are also still meaningful. And we can't say for certain that just because somebody went through deflection, they impact some of their social determinants of health, doesn't mean that we've addressed all their problems, right? And it also doesn't mean that deflection didn't work. It works in these other ways, but I just wanted to kind of highlight that there might be some other things that could be collected. Now, whether or not it goes towards a particular standard, that's going to be difficult to say, right? There's not going to be some way to do that. But at the same time, you could say programs need to be collecting at least one of these other factors that we know are associated with these problematic behaviors. Antisocial friends and associates, antisocial family members, and folks that are basically driving you into substance use, that type of stuff. But right. They could be addressed by the social determinants of health too. So I guess it's more of a comment. I'll stop now.
No, thank you, Chris. I appreciate it. And yeah, Steve, let's go to you.
Yeah, I'm gonna echo those comments a little bit. I think there are a number of factors that you could measure, and those would include ability to keep a job, ability to maintain housing. Those things are fairly objective and trackable, I think. Period of abstinence post completion, which is less reliable because it's going to be based on self-report, and then period of non-recidivism, which I'll play to type as the prosecutor here and say that's, to me, that's the most important part. If they can go either 1, 2, or 3 years post completion without another arrest, I would consider that success.
That's fantastic. And yes, definitely we will have part of this discussion again when we look at the criminal justice outcomes next time. It too, surprise, will not be perfect because we don't have 2 or 3 years on everybody. And we'll be trying to come up with the best way to look at that in the interim. But I appreciate that very much. Thank you, Steve. And Lisa will be our last comment for the program data findings, and then I'll turn it back over to Will. Thank you, Lisa.
Thank you. 2 quick points. I want to really second the earlier recommendation to use the SAMHSA recovery framework to frame outcome success in the realm of recovery. the 4 elements, there's like the one word definition, but the 4 elements are a safe place to live, access to healthcare resources, relationship, and hope of a meaningful life. And those sort of like domains, I guess, of progress, I think tying this work back to that recovery framework would have a lot of merit for reasons that we could get into another time. I also want to just make a comment about the difference between data and evaluation. We know it's very difficult to know whether a future arrest means anything about the efficacy of the program because you need sort of a compared to what baseline, and it's really difficult to grasp that within just sort of within subjects data that you're working with. And so urging that the question of like, is a methodology generally effective in achieving recidivism reductions? To try to answer that goal, that question through ideal models, and then the data you're collecting are just tracking whether or not implementation is matching those models that are selected to achieve those goals. I have found that like you could be making incredible progress with somebody who is just their whole history is spinning in and out of the legal system, and they quote unquote only have 3 new encounters with law enforcement in a 2-year period. And honestly, that's just revolutionary. It's like day and night compared to the way that they were living in the past. So being able to look at whole population progress against a comparison group, I think is really important to understand whether you are actually making progress. Also, encounters with law enforcement, last point, encounters with law enforcement tends to be more a product of emphasis, capacity, staffing, political prioritization, and policy direction to law enforcement than it does the individual behavior of an individual person, which is another reason why having a comparison group is so important to understand whether your intervention is actually making a difference in that individual's behavior.
Thank you so much, Lisa. No, that it was a lot and all really good. That's why I'm like, wow, okay, I got to take that in. I'm glad this is being recorded. I appreciate that very much. And I think that several things. It would make sense in our analysis of the criminal justice outcomes data to look at both, as Janie said, like what's the prequel to entering deflection as well as the outcomes that we have available. And I think it would make sense to look at a comparison group of those, who got deflected and didn't get deflected. I am not able to promise anything to you at this moment about how far down that path we'll be able to go in terms of robustness of models or, extent of analyses. We will definitely do the best we can given our capacity and the very tight timelines that we are on for standards development. But yes, regardless of what we are actually able to do, your input and your advice is very, very welcomed about all of this. So thank you all so much. I'm going to turn it back over to Will now.
Thanks so much, Kim. And thank you all panel members for your attendance today. Some of the data has been heavy. I'm so grateful for your attention and your willingness to engage with us and help us better understand from your experience. Before we adjourn, my hope is for us to zoom back out. And so at the next meeting, we will be looking at the CJ data as well as published literature, including that 2025 best practices report authored by Erica Simeon et al. From OHSU. But broadly, what else would you ask us to consider or keep in mind as we proceed over the next 2 months with the initial draft of deflection program standards? Yes, MJ.
Hello. I think something just to consider for some of these data points I'm looking at, there's a consistent measurement of law enforcement involvement after the initial involvement in getting enrolled into the program.
I don't know if it's similar with other programs, but law enforcement is designed for our program to start the enrollment and then to kind of bow out and leave it to the navigators and the peer mentors. I would be interested in knowing maybe in the future, not necessarily now, but like what the availability of resources to the navigators was during the recovery process versus the involvement of law enforcement throughout that whole process.
Thank you so much, MJ. I just want to restate that and make sure that I have a clear understanding. So the first part discussed in detail the sort of consistent measurement of like whether and how law enforcement is involved beyond that initial sort of front end part of the program, and as well sort of the level of resources, right, available to peer navigators or others alongside that. And those, as you mentioned, those may not be questions that we can answer right now, but certainly like ideas that we can take in for the future as we're looking at this over time. Did I adequately capture it?
Yes, you did. Thank you.
Thank you.
I would say, in case this is relevant or helpful, MJ, although we looked at those law enforcement involvements at the really first point of contact, eligibility, handoff stage, pathway, that's really all we have. So even though I traced them across to all of these end result outcomes, that doesn't necessarily suggest that some programs are involving law enforcement all the way through, in case that's helpful.
That makes total sense. Thank you.
Yes, Andrea.
Hi. So I guess just being an advocate again for my very rural area over here. I know there are folks live in rural areas as well, but one of the things I really appreciated about the rollout of deflection programs was the autonomy to be able to develop our programs around what made sense for our counties and communities. So making sure that that kind of stays in the forefront as we're developing those standards, that they don't become so rigid that they impose barriers on those different communities that are operating them. And then also just consideration, kind of coming back to what I was trying to state earlier, I think it's so important for law enforcement to be involved in these programs as they're engaging with these folks on a day-to-day basis. But there was no requirement, and not that I want to make it required, but it was more of an encouragement. And I think that has shown up differently across different counties, which has impacted a lot of the numbers. And so kind of back to my earlier comment and just kind of what we've experienced is we've got buy-in from leaderships on the law enforcement side of things, but not so much the boots on the ground, which has made a lot of difference and has led us towards having to lean more on those other pathways, which isn't a bad thing. But I think that we could see more involvement if there was more buy-in, and without kind of a push or a nudge for that to happen, I think it makes it challenging in some different counties, is what I'll say. And I'll leave it at that.
Thank you so much, Andrea. Again, there was sort of two parts there that I want to make sure and capture. Starting with the most recent, it's really not just if or whether law enforcement is involved, it's the quality of that involvement and how some local programs have perhaps interpreted that differently, what that partnership means, and it could have sort of cascading effects throughout a participant's journey through the program. And then as well, at the front end, I certainly heard that this not making this sort of standard so onerous that rural and frontier counties are disadvantaged in their attempts to adhere to those standards. And so I can say certainly we're looking at standards as like not the ceiling, but like the sort of floor there. And so we are considering those rural and frontier spaces as we're working through this, but I appreciate the reminder.
Thank you, Will.
Yes, Janie.
Thanks. I think I have a two-parter, and I'm going to really work hard to just be right to the point and not squirrel or spider web too badly. It's been great to look at the individual success for participants or those that got enrolled. I do wonder about how to measure success for the programs specifically in light of, you know, what we've heard many times is the appreciation for the autonomy of counties to be able to tailor it to what they need. And so in thinking about Oregon and how we've ranked in access to services, is there a way we can measure without just like how many people did you count, but how was the more global need served compared? How was the need improved? And I don't know if I'm asking that right. And I'm not going to ask the second part of that because I think that was enough.
Okay.
And I'm not sure I made sense.
Janie, I think you did make sense. I want to restate it just in case, but going back to this idea of individuals nested in programs and their individual success in terms of reaching the completion criteria for that particular program is perhaps not exactly answering a different question, which is sort of globally, if we kind of look out at the zoomed out level, right? Like how are the programs being successful, right? Overall, which may use a slightly different way than we do for individuals. Am I getting it right? Perfect. Okay. So yeah, Kim, I'm glad for you to jump in and help me answer this, but I think that these sort of profiles can contribute to that. This idea of like taking a look now early on what is happening sort of with the highest likelihood and lowest likelihood across the particular outcomes. I heard the comments about sort of Oregon's rank in terms of access and how was the need improved. I know that we did sort of back in February for those that were incomplete. We can start to track some of that partial improvement, but in terms of like the broader global look at programs, I may defer to Kim on that.
Yeah, and I won't take too much time, but I appreciate the reframing, Janie, to remind us that it's not all about the participant, improvements. And that's what we did specifically. We tried to hone in to see where do programs differ in how effective they are. That was our whole purpose there, but it definitely is not to obscure the fact that, hey, a lot of participants are getting services and assessments and improving on social determinants of health. So we will take that to heart and not lose sight of the big picture when we're thinking about standards.
Jordan.
I just wanted to kind of touch on the flexibility within programs, and coming from like a smaller county in Oregon, you know, we do have limited resources and we have other barriers that, you know, larger counties may not be facing. And so I just kind of wanted to touch on, you know, like creating standards that don't unintentionally limit a program's ability to like adapt to the realities of its own community, you know, and just setting a bar so high that we can't keep up and serve the population that we're trying to serve, you know, in a way that we want to, then we would be able to. So yeah.
Thank you very much, Jordan. So what I heard there is, again, really think of these standards as a floor and not a ceiling, especially because potentially some counties may already have a ladder, right, to reach a ceiling in the closet, and some others may not have that ladder. And so,
yeah. Yes,
thank you so
exactly.
much. Yes, that is absolutely something that we will keep in mind. And our goal, again, is floor, not ceiling. And y'all, we still have perfect. Yes, Chris.
So I appreciate all this and all the work that you all did, and Kim, thank you for that. I'm thinking about, I'm kind of going back to my original question about bringing in additional metrics that we kind of have access to that weren't necessarily in here that might be meaningful, and kind of speaking to the difference between the rural versus urban settings. And I believe, and correct me if I'm wrong, but through the burn network and through the deflection funds, we kind of have a sense of who all the service providers are and what capacity is. and where they might be located in a given county in relation to a lot of where maybe a lot of their population is that need those services. The basic like Euclidean distance from the place where they got to go to the place where they're actually interacting with either law enforcement or a peer service or something like that could mean, you know, a lot in these models. And I think those are a couple of variables that you might be able to pull in, and it might impact how these things play out, especially in a multi-level model. And that's more of a higher level statistical stuff. But I do think that there's a lot to be drawn from this space and this data that you all have collected. I just want to make sure that it doesn't like pander to the urban counties, and then vice versa. We collect or create standards that are speaking to everybody, but there is such a wide swath of what they're capable of because of that distance, and among other things, availability, how many services are actually in that space. I think those are just things that we should keep in mind, and maybe that becomes a qualifier of some standards.
100%. That's really helpful, and I might reach out to you to just talk further about your ideas about other data sources if we have capacity for that, which we may not. But 100% to all of you who are saying, hey, make sure you're thinking about the range of programs that we have and the range of regions in which they exist and the range of capacities and funding. And we are. And you know, the program profiles were limited to programs that had at least 30 entrants, but the model included everybody who had more than 3. So everybody is accounted for, and this is part of why I don't want to get too granular with my analyses, because then we will be talking about a different set of realities. But also, you all are here for this very reason, to make sure that these standards are usable across a variety of programs that are serving Oregon residents. Enough from me.
Thank you very much, Kim. Clint, I see your hand. I believe we are drawing near the time, so if there's anybody else who wishes to speak after Clint, if you could go ahead and raise your hand so we know how many folks are left. But Clint, please go ahead.
Yeah, just one thing I wanted to highlight on when we look at the stats. Again, I really appreciate everything today and everyone's thoughts. When we were looking at those that completed didn't, and I think it was like 96% were referred by law enforcement. I think that's also a positive, because that's 96% of people that law enforcement wasn't doing something different with, but it's showing the culture change. It's showing the change in thinking. And so when you look at that, some people can look at that as like a success or a failure. I see it as a success, because we're never going to take law enforcement out of this. They're going to be responding to these calls day in, day out. And so I think you just take it one step down below of like, why weren't they successful? Why didn't they complete? But the part that law enforcement deflected them, that's a success in itself right there. And so I just think we build off those successes. And we all know law enforcement working with navigators and peer supports together is the best probably outcome model than one independently from the other. Them working together is probably going to get the best. I just wanted to bring light to that even though it shows that, that's still a positive in my mind.
Thank you, Clint, for saying that aloud and for the reminder. You're absolutely right. Right. Each of those times is a time where something else could have happened but did not. Right. But for this deflection event. Thank you very much for that reminder. So we do just want to make sure, is there anyone else who wishes to speak before we move on in the agenda? I don't want to cut anybody off. Seeing no movement. Okay. So we do have one additional agenda item, which is public comment. Casey, would you please call for that, please?
Yeah, thanks, Will. We wanted to, again, intentionally pause for comment from the public. If anyone has something that they would like to share. We invite you to either raise your hand or come off mute, depending on how you're joining and how it's best for you to participate. We have about 8 minutes left of this meeting, and I need some time to discuss next steps. So I'll ask that you limit your comments to no more than 2 minutes. And then as a reminder, both CJC staff and members of this expert panel are not able to answer any particular questions during this allotted time, but you're welcome to reach out to staff separately after the fact. So I will pause now and invite anyone who is a member of the public to make comment. Thanks for your patience during this like 30-ish seconds of silence. I just want to make sure that folks have the time to get off mute, hop on. It can be awkward sometimes. So we'll give it, I don't know, 10 more seconds. All right, I'm seeing and hearing none, but please don't let that exclude you from thinking about sending us an email should you wake up in the middle of the night and have thoughts on deflection. Kim, would you mind sharing our next step slide? Thank you.
Getting there.
Yeah, you're getting there. Thank you. Okay. Well, let's see. First and foremost, panel members, thanks for being here. Thanks for your thoughts and reactions and comments today. And also thanks for your patience and understanding as we kind of figure out how best to run these meetings. I know that this is a lot of information to digest and consider and react to, and that takes time. And this is the first one of these, and hopefully they will just get better and better each time, and we'll dive into this information. I have a couple to-dos outlined on this slide. For expert panel members, please respond to the availability poll when it comes out. We intend to get the remaining meetings, so the August, October, and December meetings on the books, and they're just reserved there on your calendar for the rest of this year. So you'll be providing your availability for those 3 meetings. Keep an eye out for that in your inbox. And then again, we invite you to reach out, ask questions, share additional thoughts. You can call us up, send us an email. Don't feel that you are limited to these meeting forums in order to provide input and feedback. You have the meeting materials sent out 2 weeks ahead of time. And please continue to react to those. We are going to be busy here thinking about everything that you said today and reviewing and incorporating your feedback as we continue our analysis. And then our last to do will be to schedule those next meetings and let you all know when those are officially on the books after we hear from you all about your availability. But that about wraps this up for today. So I'll just end with a thank you and ask if there are any particular questions from panel members about next steps or logistics or anything to that effect. Yes, Jordan.
Just as far as sending out some additional afterthoughts, should we send them to you, Casey, or somebody, a group of you guys?
Yeah, that's a great question. I will ask that will be sent to Avery, kind of as our triage to get to the right person.
Okay.
So thank you for asking.
Yeah, thank you.
All right. Well, I hope no one does wake up in the middle of the night thinking about deflection, but until we see you next, sometime in August, I hope that you're enjoying the warm weather and yes, everyone take care. Thank you so much for joining us today.
Thank you.
Thank you.
Thank you all.
Thank you.
Thank you.